Okay, shall call the committee to order. And just before we start with our first witness, just wanted to get authorization from the committee to send a letter to the Speaker, the Chair of the Board of Internal Economy with regard to the Canadian Council of Public Accounts Committee meeting in Regina, Saskatchewan, August 25th to the 27th, 2013. Is that agreed by the committee?
Agreed.
Agreed? Okay, it's agreed. So, and I'd like to invite Mr. Richard Jackson, Director, Emergency Health Services, Land Air Direct Services Division, Ministry of Health and Long-Term Care. And our clerk is looking for something behind me. Probably the affirmation, I assume.
Rotations, is that?
Yeah. Sure, we'll do 20-minute rotations and then see how much time we have. You have till 2 o'clock with Mr. Jackson. Just
sorry, give me 1 second.
This beer doesn't it?
I've got it though, just 1 second. Yeah, we're good.
All set?
So, sorry, Mr. Jackson, if you just raise your right hand, please. Mr. Jackson, do you solemnly affirm that the evidence you shall give to this committee touching the subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth?
I do.
Thank you.
You have up to 10 minutes for an opening statement if you wish to make one? 15. 15? Okay, sorry, 15 minutes.
Okay. Can people hear me? Okay.
Yes, I believe so. If we need you to speak up, I'll interrupt.
Good afternoon. My name is Richard Jackson. In my opening remarks, I would like to first briefly provide committee members with an overview of my career in the Ontario Public Service, and then provide the committee with updates of actions the Ministry has taken to improve the oversight of air ambulance and related services provided by Ornge. I am the Director of the Air Ambulance Program Oversight Branch, a position I have held since July 2012 when the branch was established. In April of this year, I was appointed to the position of the Director of the Emergency Health Services Branch. Consequently, I am now accountable for the oversight and regulation of land and air ambulance services in Ontario. I have devoted my career to public service. I joined the OPS in 1982 and have held several senior management positions with several ministries. From 2009 to 2012, I was the Toronto Regional Director for the Ministry of Community and Social Services and the Ministry of Children and Youth Services. And previously, I have held several senior positions with the Ministry of Training, Colleges and Universities, including the Ontario Student Assistance Program Director, the Superintendent of Private Career Colleges, the Executive Assistant to the Deputy Minister, and the Finance Manager with the Colleges Branch. I have taken on the responsibility to lead air ambulance program oversight because I wanted to make a positive contribution in ensuring Ontarians requiring critically important medical transport services receive the best possible care and that these services are delivered in an accountable and transparent fashion on behalf of Ontarians. I would now like to provide the committee members with updates on the work we are doing to improve the oversight of services provided by Ornge. In establishing an enhanced oversight regime for air ambulance services, the Ministry's key objectives are to ensure patient care and patient safety standards are met, and that financial accountability and public transparency are enhanced in the delivery of the vital services Ornge provides and that Ontarians pay for and that Ontarians expect. Our work is guided by the detailed recommendations made by the Auditor General in his special report on air ambulance and related services, as well as the terms and conditions of the amended performance agreement that was ratified by the Minister of Health and Long-Term Care, Ornge's interim president and CEO, and the chair of Ornge's board of directors on March 19, 2012. The amended performance agreement has strengthened accountability and transparency in the delivery of air ambulance services. The amended agreement makes patient care and aviation safety paramount, and we are ensuring that Ornge is delivering against these requirements. I would like to outline for the committee members examples of the enhanced oversight provisions that are in place as a result of the amended agreement. In response to the Auditor General's recommendations, the amended performance agreement contains additional key performance indicators and increased reporting requirements. The amended agreement outlines principles that Orange must follow in providing the services outlined in the performance agreement. I would specifically note that Orange's operations must operate on a not-for-profit basis. The amended agreement contains several elements relating to quality improvement and patient relations that mirror the requirements of the Excellent Care for All Act that applies to public hospitals in Ontario. These provisions include a quality committee, patient satisfaction surveys, a patient relations process, including a patient complaints process, and a patient advocate function, a patient declaration of values, and annual quality improvement plans. Under the amended agreement, a number of actions by Orange require the Ministry's prior approval. These include the purchase of real estate, incurring debt, the sale of assets, as well as any changes to Orange's corporate structure. Orange is required to post a broad range of information on its website, including its complaints process, its quality improvement plan, and its conflict of interest policies. The performance agreement outlines the comprehensive range of air ambulance services and related services that Orange provides. The services the provincial government funds Orange to provide include the dispatching services for air and critical care land ambulances, the provision of air and critical care land ambulance services for interfacility transfers and on-scene calls, coordinating organ transplant recovery flights in response to requests from the Trillium Gifts of Life Network, operating the Provincial Transportation Authorization Centre to provide medical transfer authorization numbers for interfacility transfers between Ontario hospitals, and a range of base hospital services, including medical direction, medical advice, paramedic certification and training, quality assurance, continuing medical education and guidance and authority for patient care interventions to ambulance paramedics. Through formalized monthly meetings and regular daily contact with senior officials, we have established a productive working relationship with Orange that has enhanced transparency with the service provider. Our role is further enhanced through my participation as the ministry representative in a non-voting capacity on two of Orange's board subcommittees, the Quality of Care Committee and the Operations Committee. The role of the Operations Committee is to assist the Board of Directors fulfill its oversight responsibilities for the quality of service delivered by aviation services in the Operations Control Centre. The role of the Quality of Care Committee is to assist the Board of Directors fulfill its oversight responsibilities for the quality of patient care and patient safety. One of the key deliverables of the Quality Improvement Plan was the development of Orange's first ever One of the key deliverables of the Quality of Care Committee was the development of Orange's first Quality Improvement Plan. The Quality Improvement Plan identifies 5 key priorities. 1, excellence in medical care by delivering the best possible care to patients. 2, highly skilled staff by ensuring that frontline paramedics and operations control staff have high quality knowledge and skills. 3, safety, both with respect to aviation safety and workplace safety. 4th, staffing and transport through having the right medical crew, the right vehicle for transport, and the appropriate level of care at the right time to transport patients. And finally, urgency according to need through the ability to respond as quickly as possible to requests for medical transport. Based on these priorities, a series of measurable objectives were identified and benchmarked with quality improvement targets established and publicly reported. I would like to inform committee members that in November 2012, Orange met the Ambulance Act certification requirements for their air ambulance and critical care land ambulance programs. Orange's ambulance service operator certificate for these 2 programs is now valid until December 2015. Under ministry leadership, the review team that conducted Orange's certification review was comprised of an emergency medical physician, a base hospital manager, senior EMS officials, and paramedics from other municipal EMS providers. The recertification review assesses whether a service provider has procedures in place to ensure the delivery of ambulance services, including compliance with applicable patient care legislation and standards, is being met. I would also advise the committee that from February 2012 to April 2013, Orange's bases and standing agreement aircraft carriers contracted by Orange have been subject to 15 unannounced inspections by ministry staff. I can assure committee members that we will continue our practice of unannounced inspections to ensure ongoing compliance with ambulance certification standards. Another aspect of our work to ensure patient safety care and standards are met is through investigations the ministry conducts in response to complaints received about potential contraventions to patient care standards. Findings from these investigations are provided to the ambulance service provider, and they are required to provide responses to the ministry to address the findings from these investigations. We receive daily availability reports and issue summaries from Orange that enable the ministry to monitor their performance against quality improvement plan targets and service delivery expectations. Through ongoing analysis of the information in these reports, the ministry has a detailed understanding of Orange's operations. For example, the number of ambulance transport requests, the number of transports provided, the availability of paramedics, pilots, and aircraft by individual base. The information in these reports is critical in understanding the level of service provided by Orange and identifying areas that require attention and improvement. The ministry has gained an in-depth understanding of Orange's program expenditures and use of government funding through the successful completion of Orange's 2013-2014 zero-based budget submission. Article 5 of the amended performance agreement describes zero-based budgeting as a budget methodology in which, quote, all expenses for every function must be justified for each funding year based upon an analysis of need, end quote. This methodology quantifies Orange's expenditures by service, for example, how much is being spent on air ambulance, critical care land ambulance, organ transplant recovery, by location, by individual base and head office, and the type of expenditure, be they salaries, fuel, medical supplies, training, etc. The zero-based budgeting requirement is an enhancement to the budget monitoring and quarterly reviews and variance analysis required of all agencies and organizations receiving funding from the provincial government. Through the zero-based budget methodology and ongoing quarterly reporting and monitoring, the ministry is able to determine how much each service provided by Orange costs and that the funding provided to Orange is being used for its intended purposes. The ministry has developed operational policy to implement key elements of the performance agreement, including the ministry approval process for the sale and lease of assets to ensure that Orange achieves value for money in instances where these assets are not required to deliver ambulance, where assets that are not required to deliver ambulance services can be disposed of. This process was used to approve Orange's request to sell 2 never-used AW139 aircraft that were sold in April 2013. The ministry has also completed a detailed review of costs and recruitment and training strategy of Orange's proposal to add a 3rd team of paramedics at its Thunder Bay base, which was approved and announced in January 2013. Later this month, a team of paramedics will be deployed, a 3rd team of paramedics will be deployed in Thunder Bay for the day shift, and by November, a 3rd team of paramedics will be deployed for the night shift. As a result, Orange's 3 aircraft in Thunder Bay, 2 fixed-wing aircraft and 1 rotary-wing aircraft will be staffed by paramedics for the first time on a 24/7 basis. Previously, there had been 2 teams of paramedics to be deployed on the 3 available aircraft. As part of the ministry's response to the Auditor General's recommendations, the ministry has contracted Deloitte to conduct a review of Orange's critical care land ambulance program to assess the current demand for critical care land ambulance transports in Ontario and determine whether the program is cost-effectively meeting the needs of the facilities that patients are being transferred between. Work on this review was initiated in February of 2013. Data gathering and stakeholder consultations are presently underway. The final report and recommendations are on track for completion in June of this year. The report's recommendations will guide future ministry decisions on the delivery of critical care land ambulance services. I would also like to advise the committee of additional audit work that the Health Audit Services team is presently taking to assist the ministry in our oversight of Ornge. The audit is focusing on board governance and accountability, Ornge's processes for preparing reports that facilitate transparency of Ornge's operations to the ministry, and Ornge's compliance with broader public sector directives. The scope of this audit focuses on the period from April 1st, 2012 to January 31st, 2013. The audit team commenced their field work on February 25th, and their final report is expected to be completed by July 2013. In closing, I'm confident that the ministry has and will continue to take positive steps forward to ensure patient care and patient safety standards are achieved, and that financial accountability and public transparency is enhanced to ensure that Ornge delivers the vitally important services that Ontarians pay for and expect. I also know from my regular interaction with senior Ornge officials and board members that they are committed to delivering the highest quality ambulance services in an accountable and transparent fashion, and they are taking action to deliver on this important commitment. I welcome the opportunity to respond to questions you will have.
Well, thank you for that opening statement. We'll go to the opposition first. Mr. Cleese.
Thank you, Mr. Chair. Mr. Jackson, thank you for joining us today. So you are the new Malcolm Bates.
I think I am sometimes described that way.
And I understand that you are both the director of the Emergency Health Services branch as well as the director of the Air Ambulance Oversight Program.
Correct.
Can I ask you how many staff do you have on the Air Ambulance Oversight Program supporting you in that function?
I have 6 staff that are fully dedicated to the Air Ambulance Program oversight role, 4 senior program advisors, a program advisor, and an administrative assistant. Our work is assisted by staff in the Emergency Health Services branch from a certification and investigations perspective, as well as assistance that is provided and work that is done in respect to financial analysis of the material that we receive from Ornge. Our team is also augmented by legal counsel as required, and instances, as I mentioned at the close of my remarks, where we're engaging the Health Audit Services team to assist us in our mandate.
Okay. What experience do you have in air ambulance or land ambulance?
Prior to taking on this responsibility in July of 2012, I did not have experience with air or land ambulance. I had considerable experience, and I will speak to this, in terms of the role that I played as the regional director at the Ministry of Community and Social Services and the Ministry of Children and Youth Services, where we were responsible for ensuring that a wide range of transfer payment agencies, be they developmental services agencies, children aid societies, children and youth mental health agencies, that they were delivering upon their requirements.
Thank
I
you.
would also,
I'll tell you, I'm
could I
really
just-
interested to know specifically about your experience in air ambulance and land ambulance, and as you indicated, you had no experience there before you took on this job. Of the 6 individuals who are obviously your key support people, I see Stephen Haddad, Susan Suchan, Mina Dio, Enan Hogue, and Isabel Jones. Are those your key people? This is from your
yeah,
website.
that's from the InfoGo. It's not quite up to date
Right.
in terms of
So
the staff members there. The staff members that work with me on this initiative bring a depth and breadth of experience in
Mr.
transfer
Jackson,
payment
I'm going to
oversight.
ask you to allow me to ask the questions.
Quite happy to
Okay.
do that, sir. Sorry.
We have a limited period of time, and there are a number of things we'd like to get to. Did any of these six people, before they were hired into the oversight program, have any experience whatsoever in either air ambulance or land ambulance,
They
yes
did
or
not.
no?
No,
No.
they did not.
The Emergency Health Services Branch had a dedicated unit of people that worked in the air ambulance and land ambulance section, but specifically we're focused here on air ambulance. Extensive experience. They worked under Malcolm Bates. Did any of those people who were in the existing Emergency Health Services Branch, were any of those people invited to join this oversight program?
They were not invited to join this branch.
They were not invited?
They were not. We
Okay.
work with that group of people, work closely with my staff. And as I said, there's not as I said, but there is a strong partnership between the two branches.
Who hired the staff that you do have in the oversight program?
I hired the staff.
You did. And who do you report to directly?
I report to Patricia Lee, who's the Assistant Deputy Minister in the Direct Services Division.
And she would have been the individual that who was in charge of the Emergency Health Services Branch that Malcolm Bates reported to when he was a director, is that correct?
That would be correct.
And she would be the same individual who, I suppose we can put this, had oversight responsibility of Emergency Health Services and indirectly of Orange when Orange went off the rails, is that correct?
I don't know the specific date that Patricia took on that role, and I can't equate to when Orange went off the rails, but certainly as when the Auditor General was doing his work, Patricia would have been the Assistant Deputy Minister.
Okay.
And I'm just going to interrupt. If you don't mind moving the microphone down a bit and speaking a little bit louder, some of the members are having a little difficulty hearing.
Okay.
Thank you.
I'd like to move to the amended performance agreement. You have some documentation in front of you that I presented and I distributed to to the members of the committee as well. I'm assuming, before we get to that, I'm assuming that you're familiar with the troubles that were brewing at Orange in terms of the siphoning of millions of tax dollars, healthcare dollars into for-profit companies, the undermining as a result of that, of the core mandate of Orange to deliver emergency air ambulance service, and the downstaffing that took place of paramedics as well as pilots. You're fully briefed and you have a good
Yes,
understanding
I am
of that
aware
background.
this.
I found it interesting, your opening statement when you referred to the amended performance agreement. And I believe the term that you used is that it now provides additional oversight authority. Can I ask you to tell us specifically what parts or clauses of the performance agreement that provide that enhanced oversight authority?
And I would refer you to, and I appreciate that you've provided me a copy of this prior to sitting down, the depth and breadth of requirements that are outlined in Schedule A and Schedule B of the agreement. And in addition to that, the reporting requirements, the heightened attention to an emphasis on quality, the requirement of a quality improvement plan, the requirement that there actually be a quality committee of the board. We also have the ability where we are taking a look at any, as I indicated in remarks, my opening remarks, approval of the sale of particular assets above a specific level and put in rigorous processes to evaluate that.
Schedule A lists some 14 reports that Orange is required to deliver to you, to the ministry on a monthly basis. Have you been receiving those reports?
I can, the short answer is yes.
All
to
of
that.
them?
If I could, I'll clarify.
Well, no,
that.
again, if you
Yeah.
wouldn't,
I will
would mind working with me,
I'm
I'd
working-
like to ask the questions because there's a reason for them.
Yeah.
If you could respond to the questions, and then we'll move on, okay?
Okay.
Have you been receiving all of these 14 reports as requested on a monthly basis?
Yes. And there's actually more than 14 reports, but
Okay, and how do you receive those? Are they addressed to you? Do you receive them, or who takes them in?
they're provided to us. We have a SharePoint site with Orange where that documentation is filed by Orange on the SharePoint site, and we are made aware when it is
And who analyzes the reports?
the people that work in the Air Ambulance Program Oversight Branch.
Okay, and do you distribute the specific reports to different individuals?
Yes, is the short answer to that.
Can you tell us who analyzes which reports?
I couldn't give you a specific crosswalk at this point between report and staff member examining this. I'd be happy to provide that information to the
Okay,
committee.
if you could do that.
Yeah.
And once they're analyzed by your staff, what happens?
For the 7 months that first off, we've been receiving these reports on a monthly basis since August. So we've spent the third quarter and fourth quarter having a full understanding from a benchmarking perspective of where Orange is in these particular, delivering upon these particular requirements. And when we see that there are challenges with certain service levels being maintained, we would be in touch with Orange and in contact with Orange to have an understanding of what is transpiring and what steps they're taking to address those issues.
And specifically, you indicate, of course, and we're all primarily concerned about the patient care aspect of the service. We know that there were serious problems at Orange in terms of meeting the standards. Of the reports that you've been receiving, let's just deal with the last 3 months. You indicate that you deal with them on a quarterly basis. Over the last quarter, can you tell us, in terms of the patient care issues, how many of the reports that you receive deal specifically with patient care standards?
In terms of the reports that deal with patient care, we would be receiving, I'll speak first at a general level. We receive reports that will provide us with information on a daily basis on the number of paramedics at each base and the level of care that those paramedics have the ability to provide, be they critical care paramedics, advanced care paramedics, or primary care paramedics.
And over the last quarter, can you tell us what the average resource availability has been across the service?
Orange's air and land bases, they have 9 air bases and 4 land bases. There have been two or more paramedics on staff 96% of the time.
And what about pilots?
Pilots, for that same time period, 97% of the time, and the aircraft were available 98.7% of the time.
I'd like,
With respect to aircraft, 98.7% of the time.
okay. I'd like to direct you to the resource availability report for March that was provided to this committee by Orange directly. Are you familiar with this document?
Yes, I'm familiar with this document.
when we look at the explanation of how this should be interpreted, it deals with all of the bases across Ontario, speaks to the availability of paramedics, pilots, and then aircraft itself. And it speaks to the out-of-service hours based on pilots, medics, and aircraft. And if I can point you to Section 3, which summarizes the combined numbers of dealing with pilots, paramedics, and aircraft. The last category, highlighted in bright yellow, refers to, and the heading of that column is ability to meet target. And for day shifts, the number that we see there is 63.8%. Do you see that?
Yes, I do.
And the number for night shifts is 55.8%
Yes.
across the service.
Would you like me to provide you details of what that number actually represents? Sorry, I'm getting ahead of you.
I was going to ask you that question.
So what that number is talking about is a measurement of level of care. So at Orange's bases, with the exception of Moosonee, which is designated as a primary care base, in Kenora, that is an advanced care base, the other bases are designated as critical care paramedic level. So in a situation where there is a team of 2 paramedics on each shift, if both of those paramedics have the critical care certification, that is deemed to meet that target. If one of them is an advanced care paramedic and the other paramedic is a critical care paramedic, it is deemed to have met the critical care standard. If there are only 2 advanced care paramedics, they will not meet the critical care standard, and that's what's being reflected in that number. Not that there isn't 2 paramedics on duty, but the certification level of those paramedics are not at the critical care level. In Orange's quality improvement plan, the target that they had established for themselves by March of 2013, and it was first measured in this way in August, so the target was set at 75%. When the benchmark for this was measured in August, it was at 54%. By the end of Q4, so the January to March 31st period, the level of care, those numbers, and you've got a number here for March, is 70.3% against the target of 75%.
So in the case of these circumstances that account to some 33% of the time, if in fact a call was to come in that required critical care paramedics in order to deal with that patient appropriately, we'd be out of luck, right?
No, we would not be out of luck. Arrangements in the case of an interfacility transport, which is the bulk of the work that Orange would do, if there was a medical escort available to augment the team of paramedics, the call could be responded to that way. I'll share a couple of other numbers with the committee to
Well,
put this
before
in.
you do that, I'd like to just finish this
Certainly.
section, okay? Okay. And I'll come back to deal with your issue in my next round. But I wanted to just deal with the issue of what it means when, in fact, a base is not able to provide service because of either understaffing of paramedics or of pilots. You have an email in front of you that I received just yesterday. And I'll read it into the record. Chair, if you could allow me, if I go over a couple of minutes here, you can pick it up on my next round. This is dated yesterday. It reads as follows. Mr. Cleese, my main concern is still the lack of accountability at Orange. At the Moosonee base, since March 15th, there have been 44 shifts that have not been covered, mostly due to a lack of crews, but some due to unserviceability of the aircraft. This says to me that the performance agreement is ineffective. Someone needs to access to the out-of-service reports, and they need to be verified, as I do not trust Orange to not be manipulating the books. The lack of crews is still due to qualified people not wanting to work for Orange. Now, here's what concerns me. Members of this committee know full well that we have been dealing, and the Auditor General had to deal with, circumstances where information was being provided to the Ministry of Health by Orange that was inaccurate. When Malcolm Bates was here testifying, he told us of the number of times that information was conveyed to him, to the ministry, by Orange that was inaccurate. We have very fancy documents here that have many numbers. What we see is that for 33% of the time, there weren't either qualified paramedics available. This information that we have, which is substantiated in the resource availability account as well, that in some cases 5% of the time, 6% of the time, an aircraft was not available or the call couldn't be made because of under-resourcing of the base. For every 1%, we're told it's some, in fact, we have a table here that I'll refer to you as well. It's headed Dispatch Reliability. And again, I'll review this with you in more detail in the next round.
You may not have enough next round.
Okay. Well, I think we will. The fact is that for each percentage point, less than 100%, that represents some 87.6 hours of aircraft time that is not available. That has serious implications to patient care. And my concern is, are you simply relying on information that you're getting from Orange, or are you fact-checking Orange? And if so, how are you doing that?
In terms of, there's quite I'd say there's a few questions. Do I have time, Chair, to respond to that? Or
No, he's pretty much out of time, but you can answer as you feel.
Okay.
If you'd like to answer him, well.
So what I would say in terms of how we are verifying that information, we have a team of from our Health Audit Services team at Orange right now, reviewing the data sources of that information so that when these reports come to us, that we can actually rely on the validity of the information. I don't at this point have any reason to expect that this information is not being provided to us on an accurate basis. One way, and it's part of a toolkit of approaches, is that when unannounced inspections are done at bases, staff can see, the ministry staff that attend at that base can see, are the people that are there, that are reported to us, supposedly there. And we've seen no indication that that has not been the case. In terms of the hours of service, so on any given day, between Orange's 9 air bases and 4 air bases, there are 348 hours of service available. And certainly 1% is critically important, but if they're down for 1% of the time in one day, we're talking about 3.5 hours out of that 348 hours that are available for service by Orange's 13 bases. The other number that I think is important to share with the committee is that in 2012, 2013, Orange received 25,292 calls for transport. Of that total, 51 were not able to be responded to because the aircraft was not available, and 130 were not able to be responded at that point in time because the pilot or the paramedics were not available.
Is that acceptable?
The target that the ministry would expect and Orange would be expecting is that it should be 100%, that this should not be, it shouldn't be 130, there shouldn't be 51, it is less than 1%, but it's a critical 1%. Every transport that happens is a potentially critical transport.
And we'll have to move on to the NDP. Mr. Singh?
Thank you. Thank you. Good afternoon. Just so I understand, you were asked some questions about your previous or your previous experience with respect to air ambulance. You indicated you didn't have any. Just briefly, in terms of how long have you been at the Ministry of Health in total then, that specific ministry?
I joined the Ministry of Health in July of 2012.
Okay, and before that you indicated you were in the Ministry of
Community and Social Services and Children and Youth Services.
Okay. And how long were you at that ministry for?
I was there from 2009 to 2012.
Okay. And in terms of the problems at Orange, were you aware of any of those as they occurred, or that wasn't a part of your ministry, so you weren't aware of them?
I would have followed what was going on in the press and hearings before this committee as an interested member of the public.
Okay. So specific to the previous performance agreement, you didn't have any ministry level experience with the previous performance agreement.
Correct.
Okay. So if I was asked to ask you to distinguish between the two performance agreements in a specific way, would you be able to do that, to distinguish between them, what makes one, substantially different or not from the other?
I could, for the purposes of my answer, I can talk about it in general terms. We can certainly provide the committee a table that contrasts the terms and conditions of each element, what is new. But what is, from a general perspective, it is a heightened sense of, heightened type of information being provided to us so that we can see firsthand what is going on at Orange and if they are actually delivering upon the expectations that we would have.
Okay. Now, do you have experience with performance agreements in general in other healthcare providers and other healthcare organizations?
I have experience in transfer payment accountability and service contracts with children and youth mental health agencies, developmental service agencies, child care centers, colleges and universities, and private career colleges.
So in terms of performance agreements, though, would you be able to compare performance agreements?
I'm not aware of a performance agreement that goes into this level of detail in terms of expectations
No, sorry.
in any of the sectors.
Just to
that I've
clarify,
worked in.
I'm asking if you've had experience with a performance agreement that you can compare, and I have a question based on that.
So my answer is I actually don't have that experience because this level of performance agreement does not exist in the sectors that I've worked in. There are service contracts that talk about specific deliverables against certain objectives and the amount of funding that would be provided and what the outcomes of that would be.
Sure. I want to ask you now about, in terms of your role in supervising or providing oversight for Orange, are you involved in the issue of salary disclosure and oversight or transparency with respect to that?
I'm not specifically responsible for the salary disclosure process that happens at organizations and agencies that are subject to the public sector salary disclosure. That is done by another area of the ministry. But I am cognizant of Orange's salary disclosure.
Okay. So I guess in that informal way, are you aware, one way or the other, with certainty, if Orange is now disclosing all of the salaries of their staff? That, in terms of this meeting the Sunshine List requirements?
Well, in terms of meeting the terms of the Sunshine List requirements, one of the specific aspects, as I understand it, is for employees of any organization, and Orange, there are certainly people still in this situation where they are in although the organization itself is not working on a for-profit basis, are assigned to work, they're assigned to a for-profit corporation.
But do you know for certain, one way or the other, if they're all disclosing their salaries or not?
I do not know
Okay.
if those would all be disclosed.
Sure. Now, in terms of your contact with Orange and your direct, so you receive reports, and some of those reports are annual, some of those reports are monthly. Is that correct so far?
Monthly, weekly, daily.
Yeah, and there's some other reports that are weekly as well?
Yep.
What is your, do you have a daily, is there daily contact with Orange that you maintain?
Rarely a day goes by that I do not speak to a senior person at Orange, or a member of my staff speaks with a senior person at Orange about whatever the matter of the day would be.
Okay. So let's talk about perhaps a weekly, 1 week's time. How much contact would you have with Orange in terms of reporting or communication by phone or meetings with Orange? Just roughly, how often does that happen in a week? One given week.
Myself personally, or the people
You and
on
your
my
team.
20 to 25 hours a week.
Okay. And what are the different things that happen in those 20 to 25 hours?
Well, every morning at 7 o'clock, we receive a report on transports that Orange conducted over the previous day.
Okay.
And in that report, there are specific references, and a transport was conducted or not conducted, and what the reason for that was.
Sure. Let me just
So we
streamline the
would
answer.
then follow up if there seemed to be some anomaly. And if I was to take a Moosonee example, sometimes the helicopter can't fly in Moosonee in the wintertime because the temperature is below minus 30 degrees centigrade, and the helicopter's certifications do not allow it to be
Thank you.
flown.
Thank you so much. Let me just
Yeah.
clarify some of the, so one of the things you receive is reports in the 25 hours. What else besides reports?
What else inside of reports?
No, besides reports.
Besides
Yeah, so
reports.
meetings or phone call communication?
So we have a regular weekly meeting with Orange where we review the progress that is being made against findings that have been identified from specific investigation reports, and what the steps that they have taken to address those findings. That would be a contact.
Sure.
If, in the case of, I mentioned the evaluation that we did of Orange's proposal to staff a third team of paramedics in Thunder Bay, considerable daily contact meetings to have an understanding of what that proposal was and when those resources would actually be on the ground to be delivered. When we would be doing quarterly financial analysis, what is the reason for the variance in the expenditure on that particular line? We meet with them formally, monthly, to talk about broader strategic initiatives.
Let's talk about, just so I have a bit of a comparison, we'll talk about a bit about the financial work that you do. Are there other ambulance organizations or other providers that you deal with in addition to Orange?
Up until the beginning of April, when I became the director of the Emergency Health Services Branch, there would be rare instances where I would have contact with other ambulance providers in the province.
So, and now moving forward, is that the same case?
Moving forward, I would fully expect to have much more regular contact with emergency EMS chiefs across this province. I'm speaking at their conference next Wednesday. I've had discussions already with the chair of the Ontario Association of Paramedic Chiefs, and we'll be building that working relationship with that group.
So do you have other organizations that report to you and provide you with feedback in terms of their service and oversight over them as well? Besides Orange?
Besides Orange, I mean, there are, in terms of the other ambulance providers in Ontario, there would be certainly a regular contact between staff in the Emergency Health Services branch and those providers.
Pardon me?
Within the Emergency Health Services branch, in terms of their regulatory and oversight role of all ambulance service providers, there would be regular contact with staff in that branch.
So do you, though, have regular contact with other organizations besides Orange?
As I said, I've started in my new role to broaden the group of people that I work with, because I now have a broader.
So it's kind of like,
Yeah.
so do you do that then? So do you meet with other?
I'm in the process of doing that, yes.
So why aren't you saying, yes, I meet with other people? Why are you saying you're in the process of it? Is there
Well,
something different?
no, I've met with other people. I've spoken with a base hospital director. I've had conversations with the president of the Ontario Association of Paramedic Chiefs. I'm building my network in that.
Okay, so comparing your contact with the other organizations and your contact with Orange, is it different, or is Orange more extensive?
Orange has been much more intensive.
Okay.
And in my work that I have done with transfer payment organizations and transfer payment agencies in the various ministries I've worked at, the amount of contact that I have with Orange is exponentially higher than I would normally
Okay.
have.
What are your independent mechanisms to double check or to confirm the information that you receive from Orange, if any?
As I mentioned in a previous answer, we presently have an audit team there now verifying the way that reports are compiled in the data is presented to us to ensure that it accurately reflects the information that is coming from their own data systems.
And how long is the audit team going to be there for?
They started their field work on February 25th and are scheduled to complete it in mid-May.
Okay.
I
And,
thought that was an important thing that we should do because we need to rely on the data that we get, so we should ensure that it is actually correct and accurate data.
and that was under your direction, this audit team?
That was my recommendation, that internal audit resources be allocated to conduct that work.
Okay, and just to be clear, this is an internal audit team from the Ministry of Health?
Yes, it's, I think technically they report to the Ministry of Finance, but they do the work for the Ministry of Health.
Okay. Based on what you're doing right now, and based on the reports you're receiving, and the fact that we have this internal audit going on that you've recommended, do you think at this point that there could be, Mr. Cleaser gave one example of some concerns raised by some frontline staff providers, but could something go wrong at Orange now, given what you're seeing and what you're doing? And if so, what could you do to prevent that, or how would you know if something was going on offline?
I don't, in terms of, do I think that anything is going offline? Could something go offline? I can't predict the future, but by the rigorous oversight that we have in place, if that was to occur, we would certainly be aware of it in a way that I think that we probably, as a ministry, had not been aware of it previously.
When you were choosing your staff, something just came to mind, and it doesn't have to be an extensive answer. I'm just curious that when you chose your staff and you hired them for this position to provide the oversight for Orange, none of your staff had a specific experience with ambulance services or air ambulance or specifically land ambulance. Was that something that you identified and weren't able to find people who had the
Well,
experience, or was that a choice that you thought was not?
I think it's characterize, I think there are different roles and responsibilities in this process. So I'll start with first, whoever it is that the government contracts to provide the service, and we'll use Orange because that's what we're here to talk about. I do not need, as the overseer, to understand how to intubate a patient. I do not need to understand how to fly an aircraft. What I do need to understand from an oversight perspective is how you actually do that oversight, or and how do I decide how do I determine if aviation safety is being maintained? What does Transport Canada say? What does the Ministry of Natural Resources, where that expertise relies? When it comes to the quality of medical care, within Orange, there's first a level of accountability with their medical advisory committee, the work of the Quality of Care Committee that is chaired by Dr. Barry McClellan. So there's that internal expertise there. The staff at the Emergency Health Services branch who have the technical training in paramedicine and oversight and, sorry, not oversight, but regulatory, are the patient care standards being achieved? So we rely on that. So there's a regulatory role versus an oversight role. And when I'm looking at people to do the oversight role, I want people that have an understanding of how transfer payment accountability works. And when I want to have people to work on the regulatory side, I want the technical skills to do that. And the mix that we have addresses that.
So, thank you. So I'm going to ask you some questions now about the financial auditing or oversight that you do. And the other area I want to talk about is the communication center, if you have any insight on that. So with respect to the financial portion, some of these reports that you receive are specifically service related, and the amount of service or amount of calls received and responded to.
Correct.
And some of the reports you receive also involve financial information. Is that correct?
Correct.
And in terms of your reviewing of those, what type of information are you receiving in the finances, and what steps do you take to oversee that?
Okay. So in terms of the material, I'll speak specifically of the finance. Is that
Sure.
what you'd like me
Yeah.
to do? With respect to the finance review of this, as part of regular standard transfer payment accountability within the broader OPS, organizations receiving funding from the government submit an annual budget, submit an understanding of how that money will be spent and for what purposes it will be spent. On a quarterly basis, there are reports back from the organization indicating what they are spending, how much they are spending, is it a variance from the plan, positive or minus, why is there a variance from the plan, the type of work that would be done with any recipient of transfer payments.
So that sounds promising. In that, do you receive information? Obviously, you must receive information with respect to compensation. The reason why I'm asking about compensation, because it was one of the key pieces that unlocked the puzzle to the Orange scandal, the problems that existed in the management, particularly the CEO, were unlocked by discovering that there was a serious issue with the compensation. To prevent that from happening in the future, as one of the key red flags that occurred in this circumstance, you receive reports on where the money is being spent and how it's being utilized. I would assume that also takes into consideration staff payment.
Correct. We would have salary information, and this is through the work that we've been doing under the umbrella of zero-based budgeting, where we can pinpoint the amount of salary that's being paid to provide a specific function, be it how much are the staff in the finance unit of Orange being paid, how much are people in the CEO's office being paid. I think we have a really good line of sight into that organization in terms of its
So you have direct information in terms of, for example, the CEO and the other management, what they're being paid and where that money is going from the public taxpayer dollars into this organization?
Yes.
Okay. And there's not, at this point in time, any barrier to receiving that information that's flowing?
Absolutely not. I cannot think of an instance where we have requested information from Orange since I've been in this job since July of 2012, where that information that was not provided, was always provided to us promptly and appropriately, I thought.
Sure. Mr. Clerk, or Mr. Chair, can I keep my time for the next round around?
Yes, you may.
Sure.
Good. Okay, so we'll move to the government then. Ms. Jazek.
Thank you. Thank you, Mr. Jackson, for attending today. When you became the director of the oversight branch, how would you describe the particular skills, training, background that you brought to this position as an overseer? What particular skills did you bring to this position?
Thank you for the question. I will start with first my role as the director of the Ontario Student Assistance Program, where under my leadership we implemented a rigorous income verification process to ensure that students were appropriate and their families were appropriately providing income information in terms of providing funding to this. We implemented a regime, an oversight regime of financial aid offices at colleges and private institutions to ensure that they were utilizing the program and their delegated authority under the program effectively. As the superintendent of private career colleges, I was responsible for implementing a new regulatory framework with respect to passing of a new legislation with respect to private career colleges. In my role as regional director, I was responsible for the licensing of childcare centers, ensuring that children and youth mental health organizations, children's aid societies, and developmental service agencies provided the appropriate level of service and utilized the funding appropriately.
And your educational background?
I have an honors Bachelor of Arts from York University in Geography. I have a certificate from the Rotman School of Management in Leading Change and a certificate from the University of Windsor Law School in Alternative Dispute Resolution.
And so would you say that when you came to understand what was required in this director of the oversight branch, did you feel that you had the transferable skills to provide leadership in this particular part of the Ministry of Health and Long-Term Care?
Not only did I feel that I had the skills to do that, the people that were recruiting for that position believed that I had the skills to do that job.
Thank you. Now, in your position as director of the Emergency Health Services Branch, I wrestle with the org chart of the Ministry of Health every day. I notice there's an A next to your name. Is that, maybe it's an old, this was the one that was provided. Are you in an acting position?
I thought it was permanent. Maybe I should pay attention to the org chart, but
this one's dated May 1st, 2013, so there is an A.
I will need to speak to people about removing my A.
In terms of, in your position as director of the Air Ambulance Oversight Program, as you've said, you've got people from the Health Audit Service team in Orange at the moment doing a very detailed review to validate the information that you receive on a regular basis. They will report directly to you, I presume, on their findings. Is that correct?
I will be one of the people that information is reported to. It will also go to the ministry's audit committee.
If you find a problem, do you have authority to correct the problem? Who would you report to if there was a problem? How does this... I'm trying to get the scope of your responsibility.
So in terms of the scope of my responsibilities, if there was found to be problems, I would be responsible for ensuring that those problems were addressed.
Okay, thank you. In terms of the relationship now, as you've described it to my colleague, I understand, therefore, that the people you work with at Orange are being cooperative, transparent, you're not having any stonewalling or difficulties in obtaining information.
That is absolutely correct. They, like us, have the same mission: make this place work.
In terms of the metrics that you're looking at in the performance agreement. I was interested in one, it's actually 2H, I guess, pursuant to Schedule A. It's the one that talks about the average cost of services provided on a per-patient basis. Is that is the cost per type of transport? In other words, is it by rotary, by fixed wing, by critical care land ambulance? How is that working?
The cost and the costing analysis that we will do, first will be at the broad level, how, $152 million and 18,700 and something transports, and what the cost of that transport is. One of the work that we're doing, and this is why we've gone into this zero-based budget approach, is so that we can have a better understanding of what does it cost to provide that transport by land, what does it cost to transport by rotary wing, fixed wing, or the special agreement carriers that Orange utilizes.
When it comes to the critical care land ambulance, will that feed in that information that you're drilling down into? Will that assist, I guess, Deloitte's in looking at the critical land ambulance program of Orange?
They are doing an extensive analysis in terms of quite a few metrics, not just financial timeframes. The Auditor General in his report quite accurately presented that the cost of a critical care land ambulance transfer by Orange is significantly higher than the cost that is provided, the Toronto Emergency EMS provides. I think there's some reasons that you could explain why there is some difference, but we need to understand, are we getting value for money in that particular program?
In your new position as director of the EMS branch, with your communication with municipal land ambulance, you may have heard that in York Region there's also considerable interest from York Region EMS in potentially providing critical care land ambulance. And so this will be factored in, whether, in other words, everything's on the table. There might be potential shifts.
Yeah, I think it's fair to say at this point everything is on the table for that. Part of the consultations that Deloitte are doing is with a segment of municipal EMS chiefs and with hospitals that provide that critical care service with their staff, because we're trying to understand the dynamics of what is actually occurring with that program and where those services could be best deployed.
Now, as part of the performance agreement, there's a requirement, and you've alluded to this, to provide a quality improvement plan, and you went through sort of the 5 areas of concentration. The one that we have is dated 2012-2013.
Yes.
Is there the next iteration, 2013-2014, being prepared?
Yes, over the fourth quarter at Orange, and my lens into this is being a member of the Quality of Care Committee. The committee has reviewed, based on information from senior Orange management, additional quality improvement metrics that could be used. One of great interest to the committee is having an understanding of how long does it take from the moment the call is made to the wheels are up on that aircraft en route. So the metrics for that have been approved by the board in March. The actual narrative report now needs to be written.
So in other words, there'll be a response time metric that will more parallel land ambulance in terms of from the moment the call is received.
I think that would be a fair characterization of that. But right now, what the standard has been is Orange will make a decision within a certain time period of whether or not they will launch that resource. But what's important to both Orange and the ministry is how long does that take from that moment to it's actually on its way.
Right. Well, it was referenced, I guess, in the Auditor General's report as well, that particular issue, with a recommendation to move in a way that it sounds like is actually happening. So when can we expect to see the next quality improvement plan?
I don't have a specific date for you.
Because when Dr. McCallum was here, he did acknowledge, and this alludes to Mr. Cleese's questions, that there was an expectation that in terms of the availability of base aircraft, in other words, helicopter and airplane, that we would hope to see some improvement over time. Is that your understanding from sitting on the quality care?
That is quite consistent with my understanding of that. And, not only do I sit on the quality of care, I sit on the operations committee, which also plays into that, because ultimately patient care and patient safety has a dimension not just of the medical care, but of the ability to actually deploy the resource.
In your understanding of the training program that's being undertaken by Orange to bring primary care paramedics up to advanced care up to critical care, when can we expect to see that substantially completed and have those additionally trained paramedics available?
The training program itself, and they've reviewed their training programs and made amendments to it to, without compromising the outcome of that training, shorten the length of that training so that they can transition people to the level of care that we need. At this point, what we're waiting to receive from Orange is the details of that plan of when that will translate into specific.
So you don't really have a date?
Well, I don't have a date at this point. We have gained experience in understanding how long it took, how long it will take to add a third team of paramedics at the Thunder Bay base. And there are training issues that need to be, the training needs to be done. And it's also, there are elements in the collective agreement that exists between the CAW, who represent the paramedics. There are negotiations that we're presently under negotiations, and I don't want to prejudge the results of that, but I think one of the things from that is that we're looking at being able to improve the pipeline of paramedics. Orange is also in some preliminary discussions with 2 community colleges to see how they can assist in that process. And actually, what happens now is that you graduate from community college and you may have an ACP qualification, but there's an additional training that requires you to take that from land to air. And they're looking at exploring that with a few colleges.
So from the perspective of the ministry and the management at Orange, everything's being done with a sense of urgency to move this program ahead?
I think it's fair to say that I will say almost everything going on with Orange is at a sense of urgency. I don't think there's anyone that is satisfied when, if the resource availability isn't 100%, there's work to be done.
In terms of the zero-based budgeting that's being conducted this year, this is clearly something new for Orange.
Correct, it is.
And so instead of going back to a historical base and receiving requests for enhancement or whatever happened in the past, you're literally going back to zero and calculating based on need.
We've asked them to, and they have built their budget from what it actually costs to deliver each of those elements. And it's not simply, let's just increase everything by 2% this year, because not everything increases by 2%. And what is driving each individual line of expenditure?
When will that be submitted then formally?
It was submitted to the ministry on, I believe it was January 30th of this year for their 13-14 plan. And then we will be measuring and tracking progress against that as we go through this year.
Sorry, it was, there's such disruption here. It was delivered to the ministry?
The board approved
Okay.
zero-based budget was provided to the ministry, I believe, on January the 30th.
And do you remember what the bottom line was, what the request was?
The specifics of the request, I'm trying to think of the exact number.
Was it more or less than the previous
It
fiscal
is,
year?
yeah, it is more than the previous
It was
fiscal
more.
year. Yeah.
Are you aware of what's happening with the various private corporations at Orange? We were presented with this very colorful chart with all the various entities. Would you be involved in monitoring the progress in winding up some of the for-profit entities?
This would be certainly an item that we would speak with at Orange on a periodic basis. There is the chart that Mr. Cleese provided that I think actually it came from Orange, and you can see the status of that in terms of the foundation and J Smart's charitable organization and what they're doing to wind that particular organization up. And I know that Orange is looking at the other elements of this that are within their control.
And you're satisfied with the progress they're making?
I am satisfied with the progress. I think you need to proceed prudently as you wind these up. They were created for a purpose, and there are interlinkages between them, and need to understand what those are and how those will play out. It's not as simple, I think, as just putting an X and saying we no longer want to have Orange Real Estate, Inc., as
Thank
they
you.
are the ones that own the building.
Do I have time left, Mr. Chair?
Yes, you do.
I'll leave it for the final.
Okay, very well. We'll move to, you've used all your time, Mr. Cleese, so we'll move to the NDP. And Mr. Singh.
So I guess picking up on the last question about winding down of the organizations, in terms of the view in your position or in your capacity, both I guess as the Emergency Health Services Director and as specifically Orange Oversight Director, your view, your end goal is to wind down or to ensure that all the entities are wound down, the for-profit?
The ultimate objective of Orange, and the ministry would certainly be in support of that, is to officially wind up the for-profit entities. They don't operate on a for-profit basis under the current regime, but that's how they are registered, and they need to. The intent is to simplify this corporate organization chart so that you could actually understand it.
Okay. And are there any policies in place that, one of the issues that came up was providing the board of directors with clear indication of ministry support of any initiatives at Orange. What I mean by that is if Orange proposes a particular strategy, or if the board of directors comes up with a particular pathway that they want to go down, or the CEO has a particular vision, that the ministry should provide a clear response in terms of do they support that initiative or do they not support it, that if you're made aware of any particular initiative, what is your policy moving forward in terms of conveying support or not?
The ministry needs to provide clear direction to Orange, I'll restrict my answers to Orange because that's what we're talking about in terms of what our expectations are. Any changes to the corporate structure requires the ministry's approval. The board has initiated and is in the process of developing a 5-year strategic plan. I'm glad to see that because I think it's important to understand where it is that you're going as an organization. And in terms of the discussions and focus groups that they will have within their organizations on what their strategies will be going forward, I have been invited to participate in that process and will participate in that process and be actively engaged.
Okay. And do you have any any idea about what direction this new strategic plan will take?
I think I don't have any preconceived notions of what the strategic plan will take. But I very much want to see what the approaches and strategies are going to be to improve the resource availability, particularly the level of care provided by their paramedics, and to ensure that the funding that is provided is being used to the best possible effect.
Okay. Currently, I'm just going to ask you some questions about the way your position works and any of the accountability mechanisms that may or may not exist with your particular role. If Orange does not, let's start with this first. In your capacity to oversee something that goes to the delivery of services of Orange, if you do not pick up on or do not notice a significant drop that occurs in terms of the level of service provided, if in 1 month all of a sudden there's a significant drop in staffing levels, or there's a significant, even a minor, but if there's a drop in the ability to service calls, and you don't notice that, or you don't pick that up, and someone else draws it to the attention of the public, perhaps an investigation by someone in the media, what would happen to you in that circumstance? How does the ministry work that way? You can educate me. I don't even know.
I'm not quite sure how to answer your question, Mr. Singh, but I'll do my best.
Give it a shot.
As the director responsible for the oversight of this organization, I hold myself personally accountable to ensuring that they deliver on I deliver on my oversight role. I can't deliver the service for them.
Sure.
But in the event that it's not, that appropriate steps are taken to address those. I took on this opportunity to make a positive improvement at this organization. I'm a little invested in making sure that this
Sure, I
works.
appreciate that. That's good.
Move to the
Oh, it's on.
government, Ms. Jazz?
Thank you. Mr. Jackson, as perhaps you're aware, Bill 11 is currently before the House, hopefully into committee soon. Did you have any input into the preparation of Bill 11? It was Bill 50 previously.
I didn't have any specific impact in terms of Bill 11. As you know, Bill 11 is Bill 50 reintroduced. That the work that was done on that was done prior to me joining the ministry. Where I have had some input is with respect to Regulation 460, which will, if passed, will require Orange to be subject to the Freedom of Information legislation. When that was put out for public consultation, I was the contact person on the website where individuals can provide feedback on that particular regulation. There was none received.
Given your expertise in oversight, do you think that Bill 11 will be important to ensuring continued accountability and greater oversight of Orange?
I think where Bill 11 is important is the type of legislation, and someone gave me this analogy recently, it's kind of like insurance. You don't need insurance when things are going well. You need insurance when things are not going well. So in terms of the oversight and regulatory toolkit that I think a regulator would want to have is the ability, if it is found that there needs to be significant change at that organization that's not taking place, similar to when that is exercised for public hospitals, children's aid societies, school boards. I think there is instances where that you would want to have that authority to do that. You wouldn't use it recklessly or frivolously, but without having that, I don't think you have the full spectrum of.
What do you think of the whistleblower protections outlined in Bill 11? Do you think they are sufficient? It's going to be a useful provision?
I think any protection that is provided to people who act in, take a whistleblowing action, to have that protection is an important element of, again, in terms of that spectrum of what you want in regulation and oversight, sometimes it's the people on the ground that are the ones that are going to know what's going on the best, and that they could come forward in a way that they felt protected.
Any time left, Mr. Chair?
Yes, you have a couple minutes left.
Oh, good. So, in your previous experience, in terms of getting complaints from employees, or I'm just following up on the whistleblower protection piece, have you felt able to deal with concerns from employees to make change, or have you been constrained in any way given your position in the Ontario Public Service?
In terms of my specific experience with Orange, or?
No, I would say just in general.
just
I mean, you
in
must have
general.
faced situations where there were complaints or employees that had concerns.
Certainly, there has been specific instances, particularly in regulating private career colleges, where one of the inputs into understanding what was going on was the fact that you would receive complaints from either employees of that institution or students that were going there that weren't receiving that, and that sheds some light and adds to the spectrum of oversight that you have available to you.
And so you would say within the Ontario Public Service there is a desire to ensure that all complaints or employee concerns are dealt with fairly and...
Well, I'm not sure if I can speak on behalf of the entire
Well,
public
but
service, but I'll
your
speak.
piece is on it.
But I'll speak on certainly where I'm involved in this. I think it's critically important that people have the ability to do that.
One of the items, again, in the performance agreement does relate, I think it's in Schedule A, to complaints. Yes, in A, operations, number 3, complaints. Receipt of complaint, it says immediately, number of complaints monthly. So have you been receiving these reports?
We have received those reports. We at our last monthly meeting with Orange, that would have been sometime in April, the Vice President of Clinical Affairs provided us with a detailed information on the number of complaints, what those complaints were, how they were categorized, and the state that they are in terms of being resolved.
Thank you very much, and we're out of time. So thank you, Mr. Jackson, for coming before the committee today. It's appreciated. Yes, Mr. Cleese.
Mr. Chair, we're just starting to scratch the surface here with Mr. Jackson. With the support of my colleagues, I'd like to ask the clerk to invite Mr. Jackson back. And in the meantime, what I would like to have Mr. Jackson provide the committee are copies of those 14 monthly reports that he's indicated his branch has received over the last, I would say at least the last quarter. I would ask that we have that available to us by 5 o'clock of Friday of this week. That shouldn't be a problem. And as well, I think Mr. Jackson undertook to provide us with the information about which staff members are responsible for analyzing which reports that he receives. And while I'll just make this comment, the reason I'm looking forward to having Mr. Jackson back is that I'm not encouraged by the fact that the very program branch responsible for oversight of our air ambulance service, the individuals, nobody in that program has any experience in either air ambulance or land ambulance. I'm concerned about that. I want to spend some more time on this issue.
Very well, and we can discuss that. And thank you for coming, Mr. Jackson, appreciate it. Our next witness today is Mr. Alan Tate, Director, Forensic Investigation Team, Ontario Internal Audit Division from the Ministry of Finance. Welcome, Mr. Tate. And just to confirm, you've received the letter for someone coming before the committee?
That's correct.
Very well, great, and I understand you're going to swear an oath, so our clerk shall do that.
That's correct.
So the Bible should be in front of you there. Perfect. Mr. Tate, do you solemnly swear that the evidence you shall give to this committee touching the subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth, so help you God?
Yes, I do.
Thank you.
Very well, and I understand you have a 10-minute opening statement, so go ahead, please.
Thank you. Thank you for the opportunity to appear before the committee. My name is Alan Tate, currently Acting Director, Forensic Investigation Team, Ontario Internal Audit Division. For the remainder of today's testimony, I will simply refer to Forensic Investigation Team as FIT. I'm a chartered accountant and a certified forensic investigator. I'll briefly outline my career and experience. After an 18-year career in public accounting, the last 5 of which running my own practice, specializing in forensic investigation, I was hired by the Internal Audit Branch, Ministry of Transportation, in 1998 as a forensic investigator. I advanced to Senior Manager Investigations in 2000s, and my responsibilities expanded in fiscal 2006 when FIT was converted from an MTO investigative unit into a corporate investigative resource. In August 2012, I was appointed Acting Director of FIT. So just mentioned, FIT is a corporate investigative resource available to all Ministry Audit Service teams. FIT provides specialist investigative services to address allegations of wrongdoing against government. Perpetrators could be either internal staff or external parties. We conduct civil, not criminal investigations. FIT is not an enforcement unit that lays charges under provincial statutes. In short, FIT is available to address allegations of wrongdoing against government where ministries do not have access to a dedicated investigative unit. It's important to emphasize that forensic engagements are designed to meet the standards of a court or a tribunal. FIT engagements provide conclusions on evidence collected following procedures consistent with the rules of evidence. The trier of fact must be satisfied evidence was properly obtained in accordance with those rules of evidence before a determination can be made if the evidence can be relied upon to render a decision. In some situations, FIT may identify circumstances that are a poor business practice or a poor value for money decision. Unless the circumstance represents a breach that could constitute wrongdoing, FIT would comment on such findings, but not address them in depth, as those are audit issues as opposed to investigative issues. I would now like to provide a high-level synopsis regarding the FIT role concerning the Orange engagement. FIT was retained by the Ministry of Health and Long-Term Care. I personally attended the Orange offices for a preliminary engagement meeting with the Director, Audit Health Audit Service Team on December 23rd, 2011. For the remainder of today's testimony, I'll refer to the Health Audit Service Team as HAST. The initial purpose of the engagement was to conduct a forensic audit for the period January 1st, 2007 to December 31, 2011. The audit was designed to assess the degree to which Orange expenditures related to the provision of air ambulance services. As this was an audit, HAST initially led the engagement. Given the litigation to recover a portion of funds was a possible result, FIT resources were assigned to provide technical support to ensure the audit met forensic standards. On January 12, 2012, I was advised by a FIT team member that they had been provided with documents from an Orange employee who stated the documents contained evidence that wrongdoing had occurred. Upon receipt of this specific allegation with supporting documents, measures were taken to convert the engagement from a forensic audit to a forensic investigation. FIT assumed responsibility for the engagement on January 16, 2011, with support from HAST. This change in the nature of engagement was a necessary yet significant development. In general, case law has established that investigations have a very specific purpose, appropriately obtaining evidence to determine the validity of an allegation. In addition, case law has established that evidence obtained for investigative purposes under pretext of an audit may be deemed inadmissible. The investigation was designed to complete the original forensic audit objective of assessing the degree to which ordinary expenditures related to provision of air ambulance services. The investigation was also designed to address specific allegations of wrongdoing that had been identified or were identified as the engagement proceeded. To complete the skill set on this engagement team, forensic accounting specialists from Investigations and Inspections Branch, Ministry of Finance, and IT forensic specialists from Corporate Security Branch, Ministry of Government Services, were assigned to the engagement team. An investigator was assigned to lead each area, each allegation that was under review. Major steps they took would include reviewing of documentation, conducting interviews, and reconciling the paper trail to the cash flow analysis, as we had a separate team of the forensic accountants focusing on the cash flow portion. Given the 5-year scope and complexity of some of the allegations, it took several months of concentrated effort to complete this investigation. Thank you. I'll now address any questions that you may have.
Thank you very much. And we'll have about 17 minutes for each caucus. We'll start with the NDP. Mr. Singh.
Okay, thank you very much. Thank you very much for attending today, sir. Just to clarify, so you've been engaged by the Ministry of Health and Long-Term Care, is that correct?
That's correct.
Do you have any involvement with the OPP investigation?
The OPP investigation is a criminal matter.
Yes.
I'll take a few minutes to explain, provide some context.
Sure.
So with respect to the OPP, we were aware, the OPP was aware that our civil investigation was ongoing. The OPP were retained in February to conduct a criminal. The OPP did not provide us with any instruction on how to conduct our investigation. The OPP had no issue with us continuing to do our work. When our work was completed at the end of June, we were approached by the OPP. They were advised of our status. They knew it was completed. The OPP did ask for, through appropriate channels, a copy of our report. It has been provided. As such, the client has understandably been quite careful in protecting the information, as no one wants to compromise the ongoing criminal investigation.
Okay. As it stands right now, has OPP advised you that the details of your findings would be, are important or are sensitive enough that they should not be disclosed in a detailed or as opposed to the higher level, as a detailed level, it should not be disclosed? Is that what your understanding is?
On advice of counsel, we advised the OPP that I have been called to attend. They advised me to answer the questions in a full, frank, and fair manner.
Okay. And did they provide you with any concern that your answering these questions would jeopardize their investigation in any way?
I interpret their instruction. They gave me no special instruction on restriction what I can say in this room today.
That's good.
So I
That's good to know.
interpret that as
I think that's a fair
comfortable with it.
interpretation. Okay, wonderful. So in terms of your findings, have you been able to, so just to frame your investigation, your evidence, the information you obtain it in a manner that's evident so that it can be used in a court of law? Is that correct?
under a civil investigation process.
Under civil,
Correct,
yes. So, and that was my next question. So you're framing some of your investigation in terms of wrongdoing in a civil context?
That is correct. For the reason why I stress the word civil is, for example, in terms of interviewing, because we are not a police agency, we would not issue a criminal caution in conducting interviews, that scenario. As a result, because we're not issuing cautions, there's a limit to, like, it would not be admissible for criminal purposes.
Fair enough. That makes sense. So that's actually very helpful. So based on what you found, have you found significant, or have you found evidence of civil wrongdoing at Orange?
I'm reflecting on the best way to answer your question. As an investigator, we have found evidence that has significant findings. As I said, the trier fact,
Right.
does have that responsibility
Yes,
to
to make that
determine guilt or
determination.
innocence.
That's good.
It's fair for me to say that there are findings in the report that a trier fact would be looking at.
Okay, could you highlight some of these issues that a trier fact would be looking at?
I'll outline some of the significant areas of our
Yes.
investigation.
Please.
We reviewed the corporate structure. We reviewed the cash flow and how the cash flow was flowed for the entire 5-year period. We did look specifically at areas that were known in the press at the time in the media, for example, the Augusta transaction. We do have a section where we did that form of analysis. In addition, we looked at remuneration. We looked at the costing of the various services that are being provided. There were some smaller allegations that came up or areas of concern about certain transactions within there that we did take a look at.
Sorry, so let me pause you there. You looked at remuneration, I follow you there. When you said costing of services, what do you mean by that?
With the structure of the Orange, and the term we use in our report is a conglomerate,
Sure.
because you had the 20 entities. We ran into a situation where there was a series of what we would call a related party transaction.
Sorry, what type of?
A related party
Related, yes.
transaction. What I'm referring to there is it would be a situation where you have two entities who are what's considered not at arm's length because there's some type of common ownership or governance. So it's fair to say that by structure, the possibility of the business relationship between related parties might not be at traditional commercial terms that two arm's length parties would conduct themselves at.
So that's an area where the costing of services between two related parties that are not arm's length within the conglomerate would be an issue. What you found would be something that you could present before a trier of fact.
Well, we identified that as an issue.
As an issue.
We felt it was our responsibility to do a fulsome investigation to consider that
Sure.
particular issue.
And do you still maintain that that is an issue that you would raise?
The evidence we found, we did not find significant discrepancies.
Oh, you did not?
Compared to, no, but I'm just saying, I'm answering the question, which is the
Yeah.
scope, like we had
Sure.
a very broad scope. We felt a responsibility to have a very broad perspective on these different issues, that we also did look at the sale and leaseback of the building.
Okay.
Those are some areas here, so, and then
And what did you find with respect to that? Any issues?
there is an issue that would still need to be looked at. For example, on the, it's been reported publicly that the Auditor General also looked at the issue. It's been reported publicly that there is a difference of opinion. The Auditor General's office has some questions about the valuation that's been conducted. There was documentation on the file where another professional firm has provided a contrary opinion. So we now have a situation where you have two professionals who do have a difference of opinion. As forensic investigators, we are not certified business evaluators, so we are not going to provide an opinion one way or the other. We don't have those qualifications. But another objective of an investigator is to be fair to all parties. That's part of the process. So we have documented that there is a difference of opinion, and if it is an area that needs to be pursued further, there would have to be, in effect, a third-party qualified expert looking at the different positions out there. But we have reported on that.
Okay. Now let me just narrow in. What evidence have you obtained in these specific areas that would be presented before a trier of fact, for a trier of fact to make a decision whether it's something wrong or not? Obviously, you can't make that determination, but what evidence have you collected that would be presented with respect to the let's talk about perhaps the corporate structure, the cash flow, and the Augusta dealing?
The process that we followed was we've prepared a documented a formal report, and that report is supported by what we call an evidentiary, we call a tab binder, a
Sure.
binder of evidence. So if a party needed to pursue this documentation, they could read our report, which is our analysis of our procedures, evidence we collected, and our conclusions on the evidence. They could refer to the documentation that we've obtained. All those detailed materials were accessed by the OPP under appropriate authorities. So as a result, they have not been, we've been very discreet in getting into the different details.
I
As
understand.
we don't want to jeopardize the investigation.
I understand. So you can talk about what you've done, but you can't talk about your exact findings as of yet.
At this stage, I'm providing as fulsome answers I believe is appropriate.
I understand. Okay. So you've talked about these. Were there any other areas that you had of concern, or areas that you investigated besides the corporate structure, the cash flow, the Augusta deal, remuneration, costing of services? Was there anything else?
We did look at we covered the building, the air covered a lot. We did look at the land ambulance program.
Okay.
The reason why we looked at the land ambulance program was because that is under a separate arrangement, and the terms of that agreement differ from the air ambulance agreement. As a result, we felt a responsibility to look in those areas and determine if the charges were appropriate, and we did identify some concerns there.
Okay. Just want to double check how much time I have.
You have 6 minutes left.
Okay, wonderful. So were you able to determine that whether money that flowed in to the not-for-profit side, you're well aware of the for-profit, not-for-profit side,
Yes.
obviously you're probably much more intimately aware of it than I am. So money that flowed in from the not-for-profit side, were you able to confirm that that money was used in the for-profit side for private ventures?
In terms of the cash flow, what our overall conclusion was we were able to map it. We actually have prepared cash flow diagrams in our document. We've determined that roughly 93.5% of the total monies in the conglomerate were ministry-related. We did identify some specific transactions, such as the debenture. There was a bond based on the value of the sale leaseback of the building. There were a few miscellaneous donations. There were some sources independent of the ministry, but the conclusion on that particular issue was the investigation did not identify any regular we did not identify a regular source of revenue that was not ministry-related.
Okay. Okay. Did you have any issues obtaining all the documentation that you required? Did you have reach?
When we went on site with interim CEO Ron McCurley, he pledged full cooperation, and in our view, the cooperation was, the staff did the best that they could. With a 5-year scope, with departed staff, there were some documents that, through no fault of existing staff, couldn't be located, or we didn't have an opportunity to try to get a version of events from those who were no longer there. So in one sense, we did have a scope limitation that way, but it was not because we weren't getting cooperation with the current staff.
I understand. Were there any significant transactions based on this 5-year gap, or this 5-year time period going back? Were there significant transactions that you felt, because of that time being elapsed, you weren't able to get sufficient information to be able to make a fulsome or to conduct a fulsome investigation? Any significant areas like the ones we touched on?
I think it would be fair to say, I'm not privy to what the OPP is looking at. The possibility I would think would exist that the OPP is looking at areas that we looked at. The fact that they're still investigating would suggest that there is evidence that still needs to be collected.
Okay. But is it the case that there is, due to no fault, just due to the reality of the circumstance, because of a 5-year time frame, that there's just information that you're not able to access at this time that will leave some issues unanswered?
In terms of our report, we've concluded to the best of our ability on the information that we had. In terms of process, for a fair investigation, if you have concerns, the normal process would be to ask the party who is involved in transactions where you have concerns for their version of events. If those individuals are no longer in the employer, we can't compel them to speak. That type of information would be missing.
Okay. I'm going to ask you some questions now regarding the Dr. Mazza and some of the loan arrangements that were set up through Orange. Did you reach any conclusion with respect to those loan arrangements?
In terms of conclusion, we did look at the loan arrangements.
Yes. Did you find
The report found that there were 3 loans were advanced. We identified 3 specific transactions.
Yes.
We found that the documentation supporting those transactions was inconsistent.
Okay. Can you elaborate in what manner they were inconsistent?
It would be, well, not trying to be, it would be like, again, it's getting into, without having to be able to present the documents, but in terms of approvals, I do, to the best of my recollection, we do have a situation where one of the documents, there appeared to be a form of approval from the board. There appeared to be email approval in one, and to the best of my recollection, in one, we did not find any evidence of approval.
Okay. Interesting. In terms of your conclusions in a broad sense, this type of transaction where the board approves of loans to the CEO of an organization, did you reach any conclusions whether that's something that's an approved practice, unapproved practice, frowned upon, or fine?
Again, as an investigator, I wouldn't be drawing a conclusion on whether or not it's a standard business practice. That really would be in the audit germane. The question that a decision maker is going to have is, was there an approval, yes or no? And once I provide those different facts, there are going to be other individuals who would say whether or not this was an acceptable or unacceptable practice.
Fair enough. With respect to the corporate structure, what conclusions can you share with us?
We identified 20 entities. We prepared our own chart. We reconciled the entities to the minute books. We looked to identify if the minute books were up to date or if they needed updating. We reviewed the board members to look to see if there was elements of common control. And those are some of the key points that we factored on there.
Okay.
Move to the government. Ms. Damerla?
Thank you, Chair, and thank you, Mr. Tate, for coming. I know this is not an easy process to have to go through. I'd like to start at the beginning. So you were hired by the Ministry of Health. Would that be correct?
The Ministry of Health and Long-Term Care was our client, correct?
And so it suggests that the ministry really wanted to get to the bottom of things, the fact that they hired the FIT of their own accord.
Yes, they wanted to bring in the investigative specialist because even at the audit stage, they were considering court action, hence the term forensic, which is why I spent a bit of time to introduce that term, because I think it is relevant to understanding our role versus traditional audit.
Yes. And so just based on your conversation with Mr. Singh, the sense I've gotten is you have completed your investigation, and now you're going to be presenting it to trier of facts. Is that what? I wasn't quite sure what that was about. Could you explain where you're at in the process?
In this situation, there's a unique set of circumstances. In the majority of the investigations where we're retained, the general process would be that the civil investigation is completed in its entirety. Then we would then report to our client. Our client would make decisions about contract issues, labor issues, depending what the scenario is, take action on that, and then they would consider if we believe that there has been some type of potential breach of the criminal code, make the referral, at that particular time. In this particular circumstance, and this isn't, although it's not unusual, it's not the first time I've had this type of experience where there has been a concurrent investigation. I've done them before, and we did them in this case. What happened in this particular case does make sense, because there was a lot of publicity about what the issues were, and as a result, once there was reason to believe there were some potential breaches, the OPP had to initiate criminal procedures, which gives them access to information that as civil investigators we don't. For example, as a criminal investigator, they can go to a judge, get a search warrant, obtain personal bank records, et cetera, et cetera.
Okay.
As civil investigators, I don't have access to that type of information.
So you've completed your investigation, you've got your report. What are you going to do with that? It's not clear to me.
Okay, at this point, with the normal process would be we would present the report to the client would make a series of decisions and then, consider referrals, et cetera, et cetera. In this particular case, the OPP did request access to our report. As a result, and we did receive instruction from the OPP that they did not want the details in this report in the public domain.
Yes, of course.
That
Yes.
would damage the investigation. So therefore, the report is available, and it will be made available to those as needed for purposes to move forward, with the proviso that no one wants to compromise the criminal.
Okay. So when you started the investigation, was there any part of the old management or the old board still operating that you had access to when you started the investigation?
I just need a moment just to reflect back mentally on my timeline here. When we first began, on December 23rd, Dr. Bass had already left. Mr. Belzner, I did not meet personally. He was on the teleconference on December 23rd. My memory is correct. Mr. Lepine was in the room. Mr. Tavender was in the room. And essentially, as we got the forensic audit going, very early on in the engagement, Ron McCurley was appointed. So in terms of interviewing some parties such as Mazza, Renzella, et cetera, we really never had those opportunities because we really weren't in investigation mode at that time.
But Mr. Belzner, you've had some interaction with him.
I was, personally, I was only involved with him on the first telephone conference on December 23rd. After that, I did not have any direct interaction.
Can you characterize for me what your sense was of that interaction with the chair, Mr. Belzner? Did he seem cooperative? Did he seem, defensive? Like, what was your sense? Did he have a sense of the scope of the issues that his organization was facing?
In the meeting on December 23rd, on the teleconference, Mr. Belzner instructed his team on the teleconference to provide full support. Mr. Belzner stated that in his view, to the best of my recollection, it was in the best interest of all parties that the issues be investigated by qualified investigators so that the issues get resolved, because it was taking a toll on everybody with a lot of concerns being expressed in the press.
Okay, so now I know you mentioned your investigation looked at a number of areas of
Correct.
Orange. I'm curious, I'd like to know more about when you were doing your audit and you went through, to me, I'm really interested in the role the board played and whether you investigated their, I guess, their governance, the extent of their governance, and whether you were able to find a pattern or anything that showed that that perhaps they didn't discharge their fiduciary responsibility to the government of Ontario as best as they should have.
Okay. We did address governance, but not as an allegation specifically. In an audit role, and one of an audit procedure would often be looking at the board governance. What we would do is we would look at specific allegations where someone said there may be some type of inappropriate conduct or wrongdoing. In the course of doing that work, we would look to see if it's relevant for the board, should have had an oversight role, we would comment on it. But it's not in relation to overall board governance, in relation to how a specific issue, such as the question a few minutes ago about did the boards, what evidence did we see of board approval or non-approval on loans? So we would look at it in that sense. And that's why I'm saying when the report is looked at by certain parties with different perspectives, they would look at the report in its entirety, and then, as I said, a trier of fact would make a conclusion on how they felt the board executed their responsibilities. It really wouldn't be the investigator looking at that as an
Okay,
allegation.
so what I'm really looking for is, in your opinion as an investigative auditor, do you think that the board fulfilled or discharged its responsibilities in the way they should have, or did you find that there was let me give you an example, that perhaps the minutes were not maintained to the highest standard, or there wasn't fulsome documentation. I just want to get a sense of your overall audit, when you went through all of the board's minutes, the way they made their decisions. Did you find that were they discharging their duties to the best of their abilities or not?
I will speak first in terms of overall board performance, then I'll have to speak more on an individual level. From an overall board performance, in the review of the corporate structure, we did find situations where there were some incomplete minutes, minute books not up to date. There were some transactions where, where was the board oversight? So in that sense, someone may review our report and form an opinion on the board governance. The question about individual responsibility, though, is somewhat more difficult, because what we wouldn't have access to as an investigator is we don't know what each individual member had been provided with when they're making some decisions. So
Right.
in that sense, I cannot answer properly that question in terms of how each individual performance did, because I don't have that information. And that was actually not within the scope of what our investigation would have covered directly.
Okay.
And Ms. Damerla, can I ask you to just move a bit away from the microphone,
is it too
please?
loud?
Yeah, just that.
Oh,
there is
usually
great.
I have the opposite problem. Okay. Coming back to the ministry, one of the challenges ministry officials have said they had in, I guess, providing oversight was that they found that both senior management and the board was not cooperative. Like, when they asked for documents, they didn't get documents, and they were strung along. In your audit, did you find evidence of that ministry officials were asking for information, but Orange and its officials were dragging their feet in providing that? Perhaps they didn't say no, but they weren't really jumping up to provide the information.
In our experience, when interim CEO McCurley was on board, we did not have any delays I consider, significant. It's not unusual. Did I get everything immediately? No, but that's not a realistic expectation. Did everything get sorted out? I did not have to go to Mr. McCurley and say, I need you to.
No, sorry, my question was, when you were doing the audit over the 5-year period, did you see evidence, not your personal experience, but
okay.
the experience of, say, an ADM or whoever was responsible for oversight for Orange, when bureaucrats were seeking information from the old Orange management? They have
Did we see
said
documentation
that there was a
suggesting that there
delay.
was not?
Yes,
that there
and
were
did you find evidence of that in your
Yes.
audit?
Yes.
How good or bad or extensive was this? Because you've done a lot of audits, so characterize for me, was it like stonewalling? Like, how would you say? Was there a pattern?
We did find evidence that some of the reporting was delayed. We do see situations where documents weren't filed on a timely basis. We did find certain circumstances where we questioned the accuracy of the data that was filed.
So would you say, based on what you noticed, that it would have been difficult for the government of Ontario to do its job of oversight adequately, given the lack of cooperation? So it wasn't for lack of wanting to provide oversight, but rather being blocked from doing so?
That's a judgment, like, from our evidence, I can say that if we have situations where we did see situations where information was not provided properly, not provided on time, yes, it would create difficulties. You know, and I feel as an investigator, again, under my code of conduct, I can't assign guilt or innocence to any party. So I can tell you what I
Yes.
saw, and yet it's really to conjecture that would lead to difficulties.
No, that was very helpful. So one of the things that I've been really interested in is, it's taxpayer money. It's used for not-for-profit ventures. But in the case of Orange, some of that money flowed to the for-profit venture. And I just want to understand from your forensic investigation, sometimes, and I think Mr. Cleese once said quite eloquently, sometimes it can be legal, but not right, or it could be plain illegal. So I just wanted to know, this flow of money, was it appropriate within the parameters of everything that was established? The flow of taxpayer money to the for-profit units of Orange?
I think it's fair to say we are aware there's a criminal investigation ongoing, so I don't know what they're looking at. There is a probe going on, so I don't think it's appropriate for me to go really beyond that, but state there's a criminal probe going on right now.
Okay. My other question was, you'd earlier said that 97% of Orange's funding was the government.
93.5.
93.7, yeah?
93.5.
0.5. I'm curious about the 6.5. Where did that money come from?
Again, we calculate that number based on the total cash flow that we were able to identify in our methodology. So the biggest source of cash outside of that was the debenture that was used with that had been issued. That was about $234 million. There was a $23 million bond on the sale leaseback based on the net present value of the leased. There were some small donations made. There was some fundraising donations, that sort of scenario. There were GST, HST rebates, that type of scenario. So
Okay.
that type of funding was there. So when we added all the numbers up, that's how the percentages came out.
Although I'd probably argue that a GST rebate is still government funding, but we'll let that be. Okay. I'm curious, one of the things that I am curious about is, in your audit, were you able to establish whether the board at times was spending taxpayer money without consideration to value for money?
Again, the value for money question is really the domain of the audit team as opposed to what we would look at. You could look at, an individual could certainly look at the findings of our evidence in the issues that we looked at, and I'm sure any reader would form an opinion as to the value for money, but as an investigator, we're looking from a mindset of, is there evidence that proves, disproves, or is inconclusive as to an allegation of wrongdoing? If we find wrongdoing, some may conclude by extension that means that it's not value for money. But the value for money audit methodology is significantally different from an investigative methodology.
Yeah, I understand
So I don't
that.
want to
Okay.
make
Fair enough.
any
Yeah.
inappropriate
Your last minute.
inference.
Okay, I'm on my last minute, so I just want to ask, if you had to say two things that you learned from this forensic investigation of Orange, what would they be?
Wow.
I'll make it one, it's okay.
That's an interesting, it was a very interesting intellectual challenge as an investigator to take on this large entity and to structure a methodology to get down to the root solution. I found, that was quite stimulating. And the challenge of looking at the paper document, reconciling back to the cash to do what we call a two-way investigative approach to ensure that we haven't missed significant issues. Those were the two things I found quite interesting in methodology that we can carry forward in other engagements.
Thank you.
Thank you very much. We'll move to the opposition. Mr. Cleese?
Thank you. Mr. Tate, thank you for joining us today. I'd be interested in your reaction based on your investigation. If you consider the following statement credible, that any of the money that was used by any of the for-profit entities in this corporate conglomerate was all unrelated to Ministry of Health funding and was strictly generated through private investors.
Mr. Clay, I would like, I just want to get clarity in your question. When you make the reference generated by private investors, does that mean actively soliciting money from external sources? or-
Any external sources other than the Ministry of Health.
Yeah. That is where the external sources was the roughly 6% we identified. So in terms of the business model, there was a business model designed, and they were in the process of executing the business model. It's really to an extent I have to defer this. I can tell you, in the report, it will document the monies we identified, how they were flowed. You could get people who would look at the facts that we have identified as investigators. There may be some who would actually support that model. There would be some who would not agree with that model. That gets into this notion of trier of fact. And that is something where, as an investigator, it's really inappropriate for me to come to a conclusion on whether I personally agree or disagree with what was done. As the investigator, what I can tell you is our work has documented where the money went, how it was transferred between the entities in that. So there are individuals who need to know for operational purposes. They can look at the facts we have gathered, and it's appropriate then to make a decision on what was not appropriate under the
So
rules.
let me, and I'm not asking you to make a judgment
Okay?
about what was appropriate or inappropriate.
Okay?
My question is this. Based on your investigation, did Ministry of Health funds flow into any of the for-profit entities?
Yes.
Okay. I'd like to discuss the commercial terms. Did your investigation deal with any relationships that shareholders or employees or board members of the Orange conglomerate have to any real estate transactions or financial transactions that Orange undertook?
In the section of our report on the corporate structure, we did spend a significant amount of time documenting the board membership of each individual entity. So we were able, and we do have charts in the report that are able to identify whom belonged to what board. So when I then look, when someone would look at the cash flow, you would then be able to see the extent of, shall we say, common interest. So those type of facts are documented
So
in the
you did
report.
find some common interests?
There were some board members who are on a significant number of the 20 entities in the conglomerate. We didn't find anyone who's on all 20. But we did find certainly some who are on more than half.
There was one transaction that involved the acquisition of a hangar in Hamilton.
Yes.
We have information that one of the key employees of Orange, I believe is Ms. Renzella,
Yes.
that her spouse actually owned that hangar. Can you confirm that that was the case?
I can confirm that we looked at that in our investigation. I can confirm that we did verify that fact. We did look to see if there's a conflict of interest declaration declared, and we determined the documentation we had was there was a verbal declaration of conflict, and we did not find evidence that that executive had signed on any documentation in relation to that hangar.
With regard to any of the financial interests that you found that board members or key executives may have had, did you find a consistent declaration in writing of conflict?
No.
Were, excuse me, were there any?
To the best of my recollection, there were some to the best of my recollection, there were some, but it would not be, I would not consider it complete.
I'd like to speak about the bond offering. It was a $275 million bond offering that was floated, and then a $30 million debenture that was floated. You're familiar with these offerings. You've read, I'm assuming, that bond offering. There were, as I read it, any investor looking at that bond offering would have concluded that the government of Ontario stood behind that offering, and the comfort that I would take as a potential investor is that I would be very secure as an investor because of the role that the government of Ontario is playing as the sole funder of Orange. Is that, would you agree with that conclusion?
I have difficulty commenting on it because I also believe that any investor has a duty to do their own personal due diligence. So as an investigator, I'm not sure it's appropriate for me to comment on the due diligence of a potential investor in any investment, aside from they would do their own due diligence.
Okay, from your perspective, though, as an investigator, a forensic investigator, if I'm an investor, the due diligence I would make is I would read the bond offering. And if, in fact, the bond offering makes it clear that the government of Ontario is the sole funder of this organization, and I did my due diligence and found out that, in fact, Orange itself as the entity is a shell. There's no other revenue, there's no history to any other revenue. The conclusion would be that I'm really doing business with the government of Ontario, isn't that right?
That is, if a potential investor wants to form that conclusion, I would have to have that conversation with that potential investor.
Okay. I'd like to talk about the loans. The loan documentation that we've seen, I'm sure the same ones I would think that you saw. Chris Mazza pledged shares in one particular case of, I believe it was Orange Peel Securities. We were told by Mr. Belzner that at the time that he accepted as chair those pledges to secure that loan, Mr. Belzner represented that the value of those securities was somewhere in the range of $200 million. Did you in your investigation find any evidence of any value of those shares that were pledged? And was it $200 million, or did you find any value in any of those shares?
In terms of the security that was pledged, our focus on the debenture issue was how the monies were actually used. So at this point, I do not recall getting to that piece of that particular issue.
Okay, so you didn't see the actual loan documents when Chris Mazza was advanced in one case $450,000, another was $500,000. Another was $250,000 advance of his bonus. Did you not see those documents?
My investigator who was in charge of that section, I do recall those are the three transactions. We focused on what the authorization was for those particular loans, and I have commented on that. At this stage, I do not recall details beyond that level.
Okay. There are certain bylaws that the organization was operating under. Did you review the bylaws that were to have guided the directors of Orange?
We did not do an investigation of the performance of the directors and their compliance with those bylaws per se. when we looked at some of the transactions or some of the issues that were of concern, we would look at how the director dealt with that particular allegation issue. So it does get back to the point that you're raising, sir. But we didn't treat it as a specific allegation issue.
Okay. The reason that I raise that is that those bylaws, I had a hard time following them. They would be issued and then amended, and they would start off by saying that directors are to receive no compensation, and yet we see evidence of directors having compensation that goes far beyond what any not-for-profit organization might have. In your investigation, did you specifically look at Chris Mazza's compensation and the various sources of his compensation within that conglomerate?
Yes, we did.
And
And we did look at other executives also.
okay, and can you just comment as to the appropriateness of the flow of funds? And were there red flags there that your investigation would have pointed to that caused you concern?
In our report, the reference we made to the specific, we did address the specific issue in our report. And as I said, we summarized the executive compensation issue. We presented what the monies were. We've also presented what the rationale was for it. And we did make a statement that as for a value, this is a value for money issue. A reader can look at the facts and they're definitely going to form their own opinion as to whether or not it's a value for money issue. But again, we're not going to do a civil investigation on value for money per se, but we have got the information there for those to make those judgments.
Your investigation would have taken you to the so-called marketing service agreement. The agreement between Augusta Westland
Oh, yes,
and
yes, okay,
Peel.
yeah. I know what you're referring to.
Yes.
Yes.
And the flow of funds, as we have had it positioned with us here in the committee, was that Orange overpaid on their contract for the aircraft purchase agreement, and that an equal amount of the overpayment was then redirected back to Orange Peel. Did your investigation uncover any evidence of that?
We have detailed analysis of that cash flow. And I do understand what you're saying. We do have documentation in there. I'm not sure how much I can say because, again, I'm not sure what is with the OPP.
Okay, I understand. I was just interested, and it's reassuring to know that those transactions, which are obviously of great concern to us, were dealt with. Just one last question for you. Back in 2008, Mr. Keith Walmsley wrote a letter to then Margaret Best, in which he, as someone who was an analyst within Orange, indicated that he had uncovered or had concerns about a number of things that were going on at Orange. I understand that the audit team was brought in. Were you part of that team that then looked into transactions at Orange, accusations of a double set of books, payments, and so on?
Yes, I can speak to the Walmsley letter.
Okay.
We were advised that there was a concern by Mr. Walmsley about a second set of books on, according to my paper file, November 18th, 2008, I believe. It might have been 08 or 09. Because it was the allegation referred to a second set of books, now that has a very specific meaning in the world of investigation. What that means in our experience as investigators is a company has got one set of books that they want to produce for, say, investors that shows a very rosy picture, and another set of books which might show a significantly lower income for, shall we say, tax purposes. So I assigned our normal process when we have these types of allegations is when we get a request for service, we log it, we have a number, we then assess what the allegation is, we assess what the rationale is for the allegation, what the basis is. If we believe there is actual evidence that would let us come to a conclusion on this particular allegation, or if there's another method that would be more cost-effective, because investigations can be very timely and costly. So given that there was an allegation of a second set of books, I assigned a team of 2. We normally do an interview with 2 people. In their careers, they have done second set of books allegations, so I wanted to have qualified people interviewing Mr. Walmsley. They contacted Mr. Walmsley. The interview was conducted November 20th. We had it at a location that Mr. Walmsley was comfortable with. We digitally record the interviews. That interview was recorded. We also spent a little over an hour with him. In that interview, it turns out that he had been with Orange for about 3 months. A lot of the information that he identified it was basically from what he could hear from rather loud discussions in this open concept. He didn't have any documents per se that he could demonstrate. He hadn't actually performed these transactions he's concerned about, but he's looking at the cash flow. And he also said he had 2 other witnesses who might be able to come forward who could provide us with stronger evidence. Unfortunately, those individuals weren't willing to speak to us, so based on that information, I prepared a communication to HAST on November 25th, where I summarized what had transpired in our interview with him. At that time, on that evidence, I did not see sufficient grounds to launch an investigation for a second set of books. I did know that there was some ongoing work being done at Orange. I shared the information with HAST, and the next time I was called in to HAST was on December 23rd.
We have 1 minute.
1 minute.
We had, Mr. Walmsley did make a number of other accusations about exorbitant bonuses and so on and so forth. And that was back in April of 2008.
Okay?
And in retrospect, we now know that many of the concerns that Mr. Walmsley had about what was going wrong at Orange, even though he may not have had the particulars, if we had to do it over again, had we launched a deeper investigation of Orange at that time, we could have saved a whole lot of agony and perhaps millions of dollars. In retrospect, Mr. Tate, would you have done it differently?
I continue to follow the same process. At any given point in time, I will look at the evidence that I have, what the allegation is, what the evidence is, and if I believe the right thing to do is to investigate, I will recommend that the investigation occurs. In this particular circumstance, with the information that we had, I know there's ongoing work going in. I reported what we had. I did not see grounds to proceed. I know there's ongoing work going on,
And thank you very much for coming before the committee today, Mr. Tate. It's very
Okay,
much
thank you.
appreciated, and the committee is adjourned until next Wednesday.